Members, good afternoon. It's the appointed time and we have a quorum. Since the last meeting, the Secretariat has not issued any information paper. As for the discussion items for the next meeting, please note that on the 4th of February, the Deputy Chairman and I met with the LWB officials to discuss the work plan for the 2026 session. The items for discussion are listed out on CB bracket 1213/2026 bracket 01. The next regular meeting will be held on the 20th of April 2026. It's a Monday. It will start at 8:30 a.m. The administration suggests discussing the following items: A. Progress in enhancing day childcare services, and B. Provision of welfare facilities at the public housing development at Kar Wai Man Road Phase 2. Do members agree? All right. Today, we will discuss Agenda Item 3, Measures and Support Services to Promote the Employment of Persons with Disabilities. Please refer to LC paper number CB bracket 1213/2026 bracket 03 and bracket 04. The government officials are here. I will invite the administration to walk us through the paper. Members who'd like to speak, please press the Request to Speak button now. Undersecretary for Labour and Welfare, please. Thank you, Chairman. Today, we will brief members on the government's measures and support services to promote the employment of persons with disabilities. The government is committed to implementing measures to promote the employment of persons with disabilities, or PWDs, enabling them to engage in productive and gainful employment in the open market based on their abilities. Major measures include employment services, providing allowances for employers and PWDs, vocational rehabilitation and training services, as well as offering grants to eligible organizations to set up social enterprises, so as to create more employment and on-the-job training opportunities for PWDs and unleash their potential. The Labour Department provides personalized employment services for job seekers who are fit for open employment. We provide post-placement follow-up services for at least 6 months as well. Under the Work Orientation and Placement Scheme, we encourage employers to employ PWDs who are fit for open employment and provide them with training and support. For PWDs who are not fit for open employment, the SWD helps NGOs set up sheltered workshops, and through integrated centers, we provide rehabilitation and employment services. Through various financial schemes, we encourage PWDs to join the job market. For example, we provide one-off grant to employers to acquire assistive devices as well as for workplace modification. This is to boost work efficiency of PWDs. To encourage PWDs to look for a job, we rolled out new measures. For example, starting from July 2025, we regularized in phases the 2-year pilot project on enhancing vocational rehabilitation services. In October last year, we enhanced the integrated centers into new centers, and they are transitioned into a new person-centered service model. Based on the abilities of PWDs, we help them unleash their potential and provide job opportunities to them. Also last year, we rolled out enhancement measures to an existing scheme. For example, we relaxed the eligibility criteria as well as extended the subsidy period so as to encourage more social enterprises to employ PWDs. To commend employers that recruit PWDs, we, together with the Jockey Club Charity Trust, rolled out a charter scheme. The first iteration of the charter commenced in October 2025, and over 100 employers were commended under the scheme. Today, I, together with the colleagues from the LD as well as SWD, are here to respond to members' questions. Thank you, Secretary. We have 11 members who have asked to speak. I'll read out the lineup first. Mr. Hong Kam In, Mr. Alex Fan, Mr. Chen Pui Leung, Mr. Chao Xiu Chung, Ms. Grace Chan, Mr. Andrew Lam, Mr. Chen Pui Kong, Ms. Elaine Chick, Mr. Tam Chun Kwok, Mr. Bill Tang, and Mr. Webster Ng. 3 minutes for each member, including questions and answers. We'll start with Mr. Hong Kam In. Thank you, Chairman. I thank the administration for providing all the information to us so that we can learn more about the government's work on rolling out measures and support services to promote the employment of PWDs. I'd like to ask about the unemployment rate of PWDs. Can you provide us with the latest figures? Second question is about paragraph 13 of the paper. It says that SWD, through the existing scheme, provide a startup fund to subsidize organizations to start their own businesses. Through a market-driven approach, the government seeks to provide more job opportunities to PWDs to enhance their employment. This scheme saw enhanced measures starting from August 2025. For example, the eligibility criteria was relaxed and the tenancy agreement requirements were refined. Can this scheme effectively enhance job opportunities for PWDs, and by how many? Also, according to the latest budget, the government will promote AI as well as digital economy. $15 million will be set aside to promote AI training. How will PWDs benefit from this? 3 questions, Under Secretary. I will first invite the Labour Department as well as the Social Welfare Department to respond to the questions. SWD. According to the Census and Statistics Department, in 2020, there were over 500,000 PWDs in Hong Kong, and the unemployment rate stood at 11%. This is the statistics from 2020. Yes, Chairman. Let me supplement. There was a special survey to study the unemployment rate of PWDs. This is different from the quarterly survey we do for abled people. Chairman, there's a different definition for PWDs, and this is a thematic study conducted by the Census and Statistics Department in 2020. And according to the studies, there were 500,000 PWDs. So this is different from the quarterly unemployment figures we obtain. Now I will ask the SWD to tell you more about the scheme. We adopt a market-driven approach to create more job opportunities for PWDs under the 3E project. So half of the posts will see PWDs engagement, and we relax the eligibility criteria. A lot of the businesses involved, they are new businesses and they need preparation time, and we allow organizations involved to have at least 6 months to start their businesses. So all of these organizations have engaged PWDs, but some of them haven't started their businesses yet, so we don't have concrete figures for members yet. Since the launch of the 3E project, under the 3E project, nearly 150 different types of businesses have been set up, creating in total about 1,460 jobs. of which about 1,020 are specifically for PWDs, and that account for 70% of the total number of jobs created. And PWDs employed include persons in mental recovery, persons with intellectual disabilities, persons with physical disabilities, as well as persons with visual and hearing impairment. Anything to add, Undersecretary? No, not for the moment. Next, Mr. Alex Fan. Thank you, Chairman. Paragraph 7 of the paper mentions that there is a pilot scheme which provides an additional employment subsidy of $500 per month to disabled CSSA recipients to encourage them to join the workforce. This deserves our recognition, and I'm glad to see that the government has been thinking of ways to encourage disabled people to join the workforce. We hope that the government could, however, adopt a targeted approach. According to recent media reports and according to disabled people, apart from their employment status, they are also concerned about their medical and rehabilitation support. For example, a wheelchair user said a wheelchair, an electric one, costs $60,000 to $70,000. They are worried that if they do not have enough subsidy, they wouldn't be able to stay in the job market. And this is a reasonable claim. Therefore, I have two questions. First, it's been a year since the launch of this pilot scheme. Has the administration collected feedback of the participants of the scheme to understand the medical support and rehabilitation support they need? Second question, will the government consider setting aside subsidies apart from the CSSA support for disabled recipients so that they can procure assistive devices and so that they have enough money for medical services? Undersecretary, we launched this scheme because we want to encourage CSSA disabled recipients to look for a job. We will only deduct their CSSA amount after they have received a certain level of subsidy. The purpose of this pilot scheme is to offer additional subsidy to disabled CSSA recipients so that they can rejoin the workforce and that they can be integrated into the community. I will ask the SWD to supplement. Well, let me supplement. Under this stepping stone scheme, we continue to disburse a subsidy of $500 per month to each disabled CSSA recipient. We are well aware of their financial status, and recipients under the scheme continue to receive subsidies from us. They have been receiving our existing rehabilitation services, for example, those offered in sheltered workshops, as well as services provided in the upgraded integrated centers. We regard these CSSA recipients as having been receiving our services and having been receiving training. The member is concerned that after the CSSA recipients join the workforce, they may earn more income and they may end up losing the CSSA payment. There are PWDs who are working in the open market and are receiving our subsidies. For example, we have the Central Fund for Personal Computers, the IT scheme for people with visual impairment, as well as a scheme on providing subsidy for higher disability allowance recipients in paid employment to hire carers. So these are schemes apart from the CSSA that we have launched to provide support to PWDs. That's all from me. Thank you.
Mr. Chan Pui-lan. Thank you, Chairman. On the government's measures and support services to promote the employment of PWD, I support them, but I'm concerned about the effectiveness of the measures. I have three questions. First, how many PWDs are being employed in the open market and how many of them have secured a job and what is the employment rate of PWD. And I wonder if the government has assessed the effectiveness of the measures and support services they've provided. Third, in paragraph 13, it is said that SWD supports the setting up of small enterprises or businesses to support PWD. It is said that a total grant of over $185 million were approved, creating 1,460 jobs. So for each job, the SWD spent about $1.26 million. So how many of these enterprises were able to break even in 3 years' time, and how many of them had to shut down their business after 3 years? And I wonder if the businesses that have closed down, if they are able to reapply for funding from the government, because if they are able to, then there may be a problem of abuse. Thank you. Before I ask the SWD and LW, Labor and Welfare Department to answer, I'll say a few words first. There are some enterprises that are set up to employ PWDs. Some don't have the support from the business sector, but for those with the support from the private sector, they were able to employ many PWDs. I attended a award ceremony of a social enterprise, and I found that the annual operating income of that social enterprise amount to some $200 million. They hired about 170 PWDs working at convenience stores and hospital. I thought that social enterprises had to be small, but the truth is that some of them are rather large. We hope that while persons with disabilities are able to be employed, people in the community can have their demand met. I don't think that is fair for you to just divide the total amount of grant approved by the number of jobs created. I will ask if my colleagues have anything to add. Let me supplement. I have some figures to share. For social enterprises set up under the 3E projects, they were established in 2001. Some of them have been here for some 20 years. They have experienced the ups and downs of our economy. They went through COVID. Among the 148 enterprises approved, over half of them are still in operation, 78 of them. However, there are 70 that have closed down. The seed money was only granted for 3 years, and after that, the small enterprises or business will have to operate on their own. As the undersecretary said, some small enterprises were very successful, and some constantly try to explore new growth points, new businesses. All these enterprises create job opportunities for PWDs. Next, Mr. Chao Shi-chung. Thank you, Chairman. I understand that the SWD and LWD have been helping PWD secure jobs, and we also have VTC that offer targeted programs to enhance the skills of persons with disabilities. But it seems that we don't have a performance indicators to assess the effectiveness of the measures and support services that we have. We are unable to have access to updated figures of unemployment rate among persons with disabilities. So it's hard for us to assess the effectiveness of the measures and support services in promoting employment of them. I wonder if the government can conduct a survey more frequently instead of having one every 7 years. This is how we can allocate resources more effectively and in a more targeted manner. Second, I think that we should learn from Singapore. We should set a KPI on the employment rate of PWDs so that we can allocate our resources more reasonably and so that we have a more clear target. Thank you. Undersecretary. I thank Mr. Chow for the questions. There are different types of disabilities. For persons in mental recovery, for persons with physical disabilities, their disabilities are easier to cater to. However, for persons with intellectual disabilities, it's more difficult for employers to hire them. As a result, I don't think that is reasonable for us to set up a KPI. If we have a KPI, then employers may hire PWDs that are more employable in order to achieve the indicator. Our goal is that we want the PWDs to integrate into community. For those that are not ready, we have to work with them. We have to also work with their parents. I don't think that is suitable for us to set a KPI for us to achieve the goals that we intend. Chairman, what about the survey? We will reflect your views to the CNSD to see if we can conduct the survey more frequently. Thank you. Next, Ms. Gray Chan. Thank you. Many PWD groups talk about the Convention on the Rights of PWDs, and in the convention it is said that we should protect the employment of PWDs. However, the government has not adopted the content in the Convention on the Rights of PWDs. I think that we should look at the framework. We're developing our 5-year plan. I wonder if the government will adopt the convention and set out clear goals and indicators. This is how we can assess the improvement in employment rights of PWDs. Second, for SEN children, well, we have dedicated much resources to promote their potential. However, on areas such as assistance from employers, VTC, are we actually offering any articulation services to the PWD so that they can secure a job after they graduate from school? Under Secretary, we have an RPP that is a project developed based on the framework in the Convention on the Rights of PWDs. I will ask the SWD to supplement later on. However, under this RPP, we try to fulfill all the points set out in the convention. I will ask the SWD to talk about what we've actually done. Thank you. Let me supplement. Last year, we regularized the pilot project on enhancing vocational rehabilitation services. And we have put in place some enhancement measures. For PWDs that are not ready for employment, we offer them training so that they can ultimately secure a job in the open market. Starting from July 2025, in phases, we have upgraded the sheltered workshops into IVRSC. We have person-centered service model. We have enhanced our support, counseling, case management, and post-employment follow-up services. This is how we empower the PWDs in the job market. Thank you. Next, Mr. Andrew Lam. Thank you. I have questions regarding the 3E project and the Enhancing Vocational Rehabilitation Services project. I'd like to know more about the small enterprise project. How many jobs been created? The government has rolled out many schemes and projects, but very often you don't give us figures in the paper you submit to the Legislative Council. It's hard for us to find out all the relevant numbers on the internet. Well, regarding the pilot project on enhancing vocational rehabilitation services, I understand that services offered in different centers vary. Can you tell us more about that? I'd like to know more about the updated situation. What challenges do older PWD face in the job market? Undersecretary. Thank you. I will ask the Assistant Direct Commissioner to talk about the figures. In 2025, we recorded 1,172 cases of employment. In the work orientation and placement scheme. After the PWDs have registered with us, our case managers will refer the registrants to the employers. So employers don't have to register their vacancies with us. As a result, we don't have the relevant figures. Mr. Lam asked about effectiveness. We do have a 15-month follow-up survey under the WOPS. Because the follow-up survey lasts 15 months, so we don't have the figure for 2025 yet. However, over 60% of the PWDs that were employed in 2024 are still on the job. What about older PWDs and their situation in the open job market? Thank you. Thank you for asking about the pilot project on enhancing vocational rehabilitation services. As mentioned, we had 8 service units. However, after regularizing the pilot project, now we have 69 service units. We have the support from the Jockey Club Trust, and the government has dedicated more resources to us, and as a result, we are able to procure more assistive devices. Some centers were able to procure 3D printers. PWDs in the centers were able to print handrails, antibacterial handrails. These are high-value products, and in some centers, we have burn facilities to burn glasses, and there are also training on how to recycle paper, so on and so forth. As some centers have undergone renovations, we have training classrooms that are modeled based on some cafes, restaurants, so that students can learn what it's like to serve at a cafe or restaurants in these centers. Let me give you some figures. Among the 69 service units, there are 1,619 students participating in the advanced training. They have participated in about 257 advanced training programs. 162 users have arranged for 319 training sessions of placement. As at end December last year, about 221 PWDs are in the open market after undergoing these trainings.
Next, Mr. Chen Pui-kong. Thank you, Chairman. According to the paper, the LD and the SWD have been offering many support services to PWDs. I want to know if there is any coordination between the two departments. For example, the work orientation and support program under the LD encourages employers to hire PWDs. And the SWD provides support scheme and offer one-off grant and subsidies to employers as well for procurement of assistive devices and for improving the work environment to help PWDs boost their work efficiency. Does that mean that employers may apply for both programs? And these two schemes are under the management of two different departments, and will employers have to make two separate applications? This is very time consuming, and this impedes employers actually from hiring PWDs. Has the administration considered consolidating these support schemes and make it more convenient for employers to apply for this kind of subsidies? Under Secretary, SWD focuses on PWDs that are not fit for open employment, and the Labor Department focuses on those fit for open employment. For example, there are social enterprises and restaurants run by social enterprises in Tema Park, and those working in the restaurant, they are fit for open employment. And for those who need assistive devices to work in positions, the relevant employers will need support. For example, employers may need high-performance screen readers as well as braille displays, and those will fall under the scope of the SWD. Well, first, I'm not sure if there are any employers who have to apply for two different grants or subsidies. And for those who need subsidies to procure assistive devices and those who need grants for employing PWDs are fit for open employment, well, if there are such cases, we'll have to look into these. We'll think of ways to take away the pressure of employers. Ms. Elaine Chick. Thank you, Chairman. $60,000 of subsidy is offered to those that take part in the work orientation and placement scheme. It's been 6 years since the launch of the scheme, and there's been inflation. as well as pay rises. I wonder if the scheme can catch up with the current inflation rate. And after the 9-month subsidy period, the participants will no longer get any subsidies under the scheme. Also, I wonder if the employment relationship between PWDs and the relevant employers would end after the conclusion of the subsidy period. Will you consider introducing incentives or subsidies offered on a continuous basis to encourage employers to continue to hire PWDs? I want to also get the attrition rate of PWDs in 2024-25. Were there any PWDs who were dismissed or who left the posts after the 9-month subsidy period? Administration, I thank the member for the questions. As mentioned, in 2025, there were 1,172 placement cases. In 2024, there were 1,134 placement cases. So the figures were quite stable, and it shows that our staff have been promoting the work orientation and support and placement scheme effectively. So there were no employers who dismissed the PWDs after the subsidy period. After a PWD is placed, we offer post-placement services to the PWD for no less than 6 months. Also, as mentioned, we did a tracking study. The subsidy period is 9 months long. In 2024, PWDs who stayed in their jobs after the subsidy period, there were 480 such cases. We also look at the effectiveness of the scheme. That is, even if a PWD has left the post under the scheme, he or she may be used to open employment already. We did a 13-month tracking study, and it shows that 60 to 70% of the PWD who took part in the WOPS stayed in the job market. This shows that the scheme has been helping PWDs to join the workforce. Next, Mr. Tam Chun Kok. First, I need to acknowledge the administration's effort in offering employment support to PWDs, from helping them to find a job and encouraging employers to hire PWDs. There have been relevant policies and measures in place. I hope the government can further unleash the potential of PWDs, and in order to do that, the government will have to step up training for PWDs. Currently, the ERB is offering training programs for PWDs specifically. However, the requirement for the qualification of mentors, as well as the requirement for barrier-free facilities, are rather high. As far as I understand, only a dozen of hospitals or organizations in Hong Kong can offer such training, and these training services do not cover all 18 districts in Hong Kong. Will the government consider allocating more resources so that there are such training courses in all 18 districts in Hong Kong? This will encourage PWDs to attend these training programs. Also, currently, many training programs offered to PWDs focus on low-skilled job positions. To give you an example, in Foshan and Nanhai, there are AI-oriented or AI-focused training for PWDs. Will the administration consider asking the ITIB to work with enterprises to provide courses that boost the digital literacy of PWDs, so that PWDs do not have to only find jobs in these low skill level? Undersecretary, we will look into the programs offered by the ERB. This year, we will amend the existing legislations to upgrade the ERB. we will implement a skill-based framework for courses offered by the ERB. We will explore how to provide courses that suit the needs of PWDs. We have already rolled out language courses as well as IT courses for PWDs. As for AI training, I think the member is talking about AI courses for those with physical impairment. There are already such courses on the market, and currently we're focusing on those with intellectual disability. We want them to make good use of technology as well. We have been studying with the Hong Kong Science Park to see how we can make use of technology to help PWDs secure a job. Next, Mr. Bill Tang. There are two kinds of PWDs that I'm most concerned about. First, those with mild intellectual disability or those with autism after they have left special schools. No one follows up on their cases. There isn't a dedicated system that traces the employment status. By tracing the employment status, I meant we need follow-up services for them. Even if those with intellectual disabilities who manage to find a job, they often fall into what we call job finding traps. So I hope there could be more support for those with mild intellectual disabilities who have left special schools. I hope that you can offer follow-up services for them for at least a few years. We need to dedicate resources to them. We need to help them to become self-reliant, so that when they are in face of difficulties, they can make use of their own skills to overcome the challenges. Second, the FTU is concerned about vocational rehabilitation support. Those who are injured in workplace, they may not be able to get back to the same job positions after they are injured. They may become permanently disabled after the injury, and so they fall under the definition of PWDs. I don't see a very strong policy or support services that help them. There are rehabilitation services in the construction industry, but we need consolidated services to support those who suffered from work injuries and need to switch to another job trade. Do you need support from the labor unions or the social welfare sector to boost the support in this regard? Under Secretary, I'll ask the SWT to study how we can offer more support to those with autism or with mild intellectual disability. We want to encourage those who got injured in workplace to be back in the job market. And there was a work injury rehabilitation scheme, but we terminated the scheme because we didn't see a high number of participants. Those who got injured at workplace and needed subsidies to get services from private hospitals, there were very few of them. I see that people are more confident with services provided in public hospitals. So we terminated that scheme that subsidized those who got injured to get support or services in private hospitals. As to how we can offer help to those who suffered from industrial accidents or who got injured in industrial accidents, we will look into this. I'll now defer to the SWT. Under the WOPS, many PWDs with intellectual disabilities or with autism have been hired in the catering businesses. Some of them can work as waiters or waitresses, and some of them have been working in food factories and who are helping with food processing. In relation to vocational rehabilitation services, our sheltered workshops have been offering support to those who were injured at the workplace. Currently, our centers are offering integrated vocational rehabilitation services. But we aren't talking about a big number of people who need such help. And there have been organizations as well as social welfare units who are offering such kind of rehabilitation services as well.
Mr. Webster, thank you, Chairman. I see that the government has dedicated much resources to support promotion of PWDs. Support program for employment with disabilities, $40,000, WOPS, $60,000. We also have Central Fund for Personal Computers, IT scheme for people with visual impairment, so on and so forth. I'm worried about the effectiveness of the use. It is said that the unemployment rate of PWDs is as high as 11%. I wonder if the government have any KPI. What is the cost in helping a PWD secure a job? What is the median salary of PWD hired? That's my first question. Second, the 1.4% of civil servants are PWDs. I think that the percentage is rather low. I wonder if the government have any timetable to enhance the ratio. I think that the government should play by example, and I wonder if you will mandate your contractors to hire a certain number of PWDs, and will you set the figures as one of your KPI? Thank you. I will ask the LWD to talk about the figures you ask for WOPS. As for the other questions, I think that you should ask the Civil Service Bureau. As Secretary Ho, the Secretary for Civil Service, said, the government tries their best to employ persons with disabilities, but I think that this question is best suited for the panel on civil service. Perhaps the Secretary for Civil Service will be more suited to answer your question. Thank you. As said, in 2024, because the tracking survey lasts 13 months, so our latest figure is as at 2024. There are 1,134 cases. Some 700 cases are with PWDs that stayed at their jobs after 13 months. The percentage is as high as 61%. Among the job seekers, some 35% of them may have left their job under the work orientation and placement scheme. They were able to secure another job with the help of PWD or on their own. And there are some 26% of PWDs that are staying at their job referred to them under the WOPS. Thank you. Next, Mr. Stanley Ng. Thank you, Chairman. The government has dedicated much resources to support employment of PWDs. I welcome the government's efforts. But I think that we have to use our resources effectively. As mentioned, the unemployment rate of PWD is as high as 11%. I think that we should allow everyone to realize their potential. Despite the level of disabilities of our people, we should encourage them to integrate into the community, because if they're able to do so, they will be able to live more healthily and happily. That's why I said that we have to use our resources more effectively. So given the high unemployment rate among persons with disabilities, I wonder if the government is trying to lower the unemployment rate. If you want to lower the unemployment rate, what would you do? Are you going to dedicate more resources, or are you going to use more effectively the resources that you have? I have one more question. If we want the PWDs to realize the potential so that they can contribute to the society, should we not give more emotional support to PWDs so that they try harder to look for jobs? Thank you. Undersecretary, I will take the second question first. PWDs are faced with greater pressure when they're trying to seek a job. As we all know, during lunchtime, say for example in Central, there is high people flow, and it's difficult for PWDs to commute. In 2024, we engaged an NGO to offer emotional support to PWDs that are seeking job in the open market so that they persevere. They will continue to try securing a job in the open market. We hope that they can realize their potential. We hope that they can find a job and secure a position. We don't want to set a hard target because we don't want to force PWDs that are not suited for open employment to get a job when they're not ready. I think that the most important thing is that we have enough support for them. Chairman, that's not what I meant. I was talking about PWDs that are seeking a job, because if they're not seeking a job, they would not be counted towards the unemployment rate. Chairman, I understand what Mr. Ng said. Because PWDs are not just any regular adult, they have different level of disabilities. We want the employers to also cater to their needs, and I think that this is what we have to work on. Thank you. It seems that members want more figures and numbers. And I think that if you can set out more figures in the paper, that will facilitate members' understanding. Thank you. If there's no other questions, we move on to the next item, that is the legislative amendments for establishing the new professional rank of health and care practitioners for the social welfare sector and career development and training of residential care home staff. Would the relevant government officials please come in? Please refer to 3 sets of paper, namely CB bracket 1213/2605, paper provided by the administration, and CB bracket 1213/2026-06, background brief prepared by the Legislative Secretariat, and there is also a letter from Dr. David Lam, that is CB bracket 1231/2026 bracket 01. As this is a legislative proposal, all members have been invited to the meeting. The administration will brief us on the paper provided by the administration, that is paper number bracket 05. Members who would like to put questions, please press the request to speak button. Undersecretary, thank you. Chairman, members, we are here to brief members on the proposed legislative amendments by the government to establish a new professional rank of health and care practitioners and the career development and training of care staff of RCH. The RCH sector has been faced with challenges in attracting new blood and retaining talent. We have engaged a consultant to look at the difficulties. And according to the study conducted by the consultant, the duties of care workers and health workers are very similar. So a new rank of health and care practitioners are proposed so that we can develop professionals for the health and care sector. As we reported the key findings and recommendations to this panel last year, members agreed to the difficulties faced by the RCH. We propose to amend the Residential Care Homes Elderly Persons Regulation and the Persons with Disabilities Regulation. There are 3 parts to the amendments. First, we want to establish a registration systems of HCPs so that the SWD will be in charge of handling matters such as registration, assessment, reporting, and complaints regarding the HCP rank. Second, we want to retain the current statutory staffing requirements, and we will allow the RCH to employ either enrolled nurse or HCPs to fulfill the statutory staffing requirements. Third, we will change the calculation of staffing requirements from the total number of beds to the number of residents. For aligning with the international practice, we will submit the relevant proposed amendments in the second quarter of 2026 under the negative vetting procedure to the LegCo. Now we are preparing to create and develop the professional diploma program for HCP that's under level 2 of the quality framework. It will be equivalent to the level of enrolled nurse. We will invite registered health workers who are holding the position for no less than 3 years to enroll in the program. The requirements is similar to those of EN General Training Program. Trainees will have to undergo training for changes of catheters, nasogastric tube. There will be 300 places. In the third quarter of this year, we will enroll the first cohort. The SWDs will set up a 3-year subsidy scheme for the PD program for HCPs. We will provide about $120,000 in subsidy for both trainees and their RCHs. The trainees must fulfill the attendance requirements and pass all assessment, as well as work in the welfare sector for 2 consecutive years. Otherwise, they will have to return the subsidy granted to them. Now, I'd like to talk about our training for care staff of RCH. From 2023-24, we subsidized over 1,700 students to enroll in the EN General Training Program. We also have a training subsidy scheme for staff of RCH. And we are studying and adjusting the content of the certificate in progression training for care workers. We welcome suggestions from members. Thank you. There are 12 members waiting to speak. I will read out their names. Dr. David Lam. Well, I will allow Dr. Lam to speak first because he submitted a letter that may be relevant to the discussion. And then Mr. Hong Kam In, Mr. Andrew Lam, Mr. Tan Kapiu, Mr. Chen Kui-Pagong, Ms. Jeannie Man, Mr. Tam Chen Kuk, Mr. Alex Fan, Ms. Elaine Chik, Mr. Webster Ng, Mr. Chao Shu Chong, Mr. Chong Ho Fong. Each member will have 3 minutes, including question and answer. Dr. Lam, please. Thank you. I will try to be succinct. I thank the administration for reaching out to us and the sector. I'd like to ask about the training, assessment, and appraisal. It is said that the QF level of HCP is equivalent to that of EN. However, the number of study hours and number of hours on placement is different from HCPs. For care procedures, I hope that the tutors will be professional care workers. As the duties of the HCP in residential care homes will be equivalent to that of enrolled nurse, I think that we need to engage a professional healthcare worker to assess the performance of the trainees. For high-risk duties to be undertaken at RCH without a professional healthcare worker, will the relevant person in charge think twice before performing a high-risk procedure? Will they perhaps undertake this high-risk procedure only when the doctor in charge is here? And I hope that the RCH will develop a code of practice. I'd also like to ask about high-risk procedures, say, for example, tubing and injections. I don't have any problems with injections because as long as infection control measures are done, the risk is not particularly high. However, for tubing, things can get complicated. For nasogastric tubing, there has perhaps no urgency, but if the tubing is done wrong, there could be danger, and the patient's life can be at risk if the tubing is not done right. Will you arrange for inspection, or will you arrange for someone to monitor the HCP when they perform such procedure? Thank you.
局長，你有冇回應？
簡單啲回應。
Undersecretary, any response? I'll give a brief response. I thank Dr. Lam for the questions. HCPs will mainly work in RCHEs and RCHDs. For nurses, they also work in hospitals and different kinds of clinics. For enrolled nurses in Hong Kong, they have the longest training hours among the world. HCPs will not have to work in so many different kinds of institutions, so we find the suggestions reasonable, but we will ensure that the assessment standards will be consistent with that for nurses. This is a new professional rank, and members of the public may have questions about HCPs. So for the first batch of organizations that organize training programs for HCPs, we ask them to be capable of organizing QF Level 5 courses in order to be qualified to offer courses for future HCPs. We will ensure that they have the equipment as well as the qualification to run the new programs. We hope that people will be confident with the new HCPs. I'll see if the SWD has anything to add. Thank you, Chairman. I'd like to add that we are very much concerned about the quality of future HCPs. They will have to abide by the Code of Conduct. In the current Code of Conduct, there are stipulation of care procedures involving catheterization and so on, and it is stipulated under the code that only qualified workers can carry out this kind of care procedures, and the guidelines issued by the licensing officers of the SWD will have to be followed as well. There will be comprehensive training as well as assessment for future HCPs. There are also a number of guidelines in place. We believe that new HCPs will be capable of carrying out the set care procedures. Next, Mr. Hong Kam-in. Thank you, Chairman. I agree that we need to establish this new professional rank of health and care practitioners. I have 3 questions. First, concerning paragraph 7 of the administration paper. It says that only existing health workers can enroll in the new program. Is that the case for the first phase? Also, the government will offer a subsidy of $112,000. Part of the subsidy will be for RCHs that send health workers to undertake the PD program. Can future HCPs undertake internship or practicum in their own RCHs? And if that's the case, that is, if they undertake the practicum in their own RCHs, will the $40,000 of subsidies be necessary? Just now, Dr. Lam mentioned about the differences between nurses and HCPs. I want to know if there will be more promotion or publicity work that helps the public understand more about the differences between nurses and HCPs, and will future HCPs be able to become nurses? This is because the remuneration package for nurses seem to be better than that for future HCPs. Undersecretary, we currently do not have the rank of HCPs, and it is not yet a statutory requirement. So on the market, there are currently no HCPs. Under the RCHE framework, nurses may lead health workers in different care procedures. In future, it will be written in the law that nurses will be at the same level of HCPs. As for the remuneration package of future HCPs, we will look into this in the future after the law is amended. SWD, in relation to the entry requirements for the HCP program, as said in the paper, we are going to offer tailor-made programs for HCPs, and the entry requirements will be the same as that for the EN program, that is the existing EN program. And we will only accept or admit health workers who have been in the industry for 3 years. HCPs will have to undertake 248 hours of training, and they will already have 3 years of work experience in the industry. We will talk to hospitals as well as institutions to make sure that they have practicum experiences. We want to broaden the horizons of HCPs to make sure that they're exposed to different kinds of experiences that would benefit their professional development. HCPs may have to undertake practicum in their own RCHs as well. We do not rule out this option or possibility. As for the differences between nurses and HCPs, HCPs are professionals dedicated to the social welfare sector. As for enrolled nurses, they are professionals dedicated to the medical and healthcare sector. So we will offer targeted training for HCPs. They will be trained to work in RCHs. We will make sure that the content of the training program as well as the assessment standards will cater to the needs of RCH, and that's the biggest difference between HCPs and nurses, because nurses are catered for the medical sector. Mr. Andrew Lam. As Mr. Chong said, HCPs are dedicated for RCH. I believe that home care will not be part of the duties of future HCPs. They will focus on working in RCH, I believe. I'd like to ask about the some figures or staffing requirements. Just now, it is mentioned that 7,700 staff will be subsidized by the government. Paragraph 16 of the administration paper says the first cohort of the program will take place in the third quarter of 2026, and 2 institutions will each launch 1 cohort of the program lasting for about 1 year with about 30 places per cohort. Have you thought about how many people will be interested in signing up for the program? And will there be a roadmap showing the number of trainees you'll be able to train up every year? If there are 7,700 staff, it will take you a very long time to train up all these RCH staff. Do you have any thoughts in this regard? Under Secretary, I'll say a few words, then I'll ask my colleagues to supplement. We of course hope to expand the number of quotas in the future, but we will have to look into the actual operation of the scheme. We want to have a good start, so we are currently looking for institutions to offer training programs first. If graduates or trainees of the first cohort of the program are widely recognized, we may expand the program. So we will offer a relatively small number of places to start with. Not all health workers will become HCPs. However, we do want to offer this progression ladder or pathway to make sure that we have a stable supply of manpower in the industry. I'll defer to Mr. Chong to tell you more. Like Under Secretary said, we will look at the response or feedback we get after the first cohort of program. We'll also see if the institutions have enough teachers or resources to offer more places. If we get good feedback, we will consider expanding the number of places. HCPs will be dedicated to working in the social welfare sector. Currently, we want HCPs to focus on working in RCHs first. We do not rule out the possibility that future HCPs may work in other social welfare units, but please bear in mind that future HCPs will have to be registered. So they will be subject to stringent requirements, but we do not rule out the possibility that future HCPs may take up other roles in the social welfare sector. Mr. Bill Tang, I have 2 questions. First, concerning enrolled nurses. Enrolled nurses for RCH operators, they are valuable resources. A lot of times only retired nurses work in RCH. This is because enrolled nurses are very popular among hospitals under the HA. The remuneration package is $24,000 to start with, and the maximum salary is $49,000 for nurses. What is the expected remuneration package for HCPs? Well, of course, it's hard to estimate the level of pay for future HCPs in the private sector, like Caritas as well as Tonghua Hospital Groups. They have their own remuneration framework. But what will be the expected income of future HCPs, will it be lower than that of enrolled nurses? Also, according to the paper, I see that there will be a major breakthrough in terms of the staffing requirement. You will change the basis of calculating the staffing requirements from the total number of beds to the number of residents. For CSSA recipients staying in private hospitals, well, you do not have the relevant figures, right? There were concerns whether there were enough inspections in the elderly wards in hospitals. If you change the basis of calculating the staffing requirements from the number of beds to the number of residents, what if the relevant institutions hide the number of elderly residents in the institutions? How will you deal with such a situation?
Undersecretary. Regarding the staffing requirement, I will ask Ms. Wong to answer that. Regarding the salary of HCP, well, the market will decide that. But as the statutory requirement is similar, I believe that the salary will also be more or less the same. In large organizations, salary of staff will be adjusted based on their years of service. In a smaller RCH, a HCP can also serve as a home manager, and that will result in a salary difference. We will monitor the market. As for your question on the staffing requirement of RCHEs and RCHD, I will ask Ms. Wong to supplement. Thank you. Currently, the license office will conduct inspections at different RCH. We also look at their staff. For high-level care homes, the calculation of staff is made based on the number of residents. Regarding the change in the basis of calculation for staffing requirement, that's for care homes for elderly persons only. The change is made to align with the international practice and statutory staffing requirement of RCH of other care levels in Hong Kong. Our patrol teams look at the total number of residents in a care home, whether or not they are present in the home or not. Thank you. Next, Mr. Chen Pui-kong. Thank you, Chairman. I'd like to ask about the capabilities and service quality of HCP. These HCP serve frail elders and elderly with illness. They work in RCHEs. However, they only have to undertake 760 hours of practicum. That's far lower than that for enrolled nurse. How can we make sure that the HCP is capable enough? And I wonder if the government will increase the number of training hours. I have a suggestion. I think that the government should promote this new rank of HCP so that families know the difference between HCP and enrolled nurse. Thank you. Undersecretary. Chairman, I thank Mr. Chung for the question. Before HCP can be qualified, they have to be a care worker first. They have to undergo 248 hours of training, and after that they have to undertake 768 hours of practicum. And altogether, they would have 1,000 hours of training. And as only care workers can be promoted to HCPs, we think that they will be more experienced. So HCP is an advanced version of the care worker, and I believe that they will be more experienced in handling elderlies as RCHEs. The benefits to having enrolled nurse is that their knowledge may be more comprehensive. But given the aging population, I think that we need both the enrolled nurse and HCPs to cater to the demand of our society. Thank you. Mr. Chong, Deputy Secretary, please. As I said, the training for our HCP is very targeted because HCP is created for the social welfare sector. We should not compare the training hours of HCP to the 2,000 hours of enrolled nurse. Enrolled nurse have to undergo training for gynecology, for example. HCP don't have to undergo such training because they only have to be well-versed in the work for RCHEs. As the duties of HCP and enrolled nurse are highly duplicated in residential care homes for the elderly. We want to enhance the capabilities of care workers so that they can take up the roles of enrolled nurse in a care home setting. That's why we have designed the enrollment requirements, the program training, assessment criteria, so on and so forth, in such a way that the HCP will be able to fulfill the duties. Ms. Jeannie Mann, thank you. Currently, one HCP and one EN will be treated as two care workers. And it is said that the study conducted by the consultant finds that we don't have to increase staffing. And I wonder if the RCHEs can reduce the number of care workers they hire. So for a RCHEs that have 180 residents, if they are hiring one EN and 4 care workers, and if they have hired a HCPs, then that RCHE will only have to hire one nurse, one HCP, and 2 care workers. So 4 staff members altogether. If a RCHE hires one EN and 2 HCPs, then their staffing requirement would have been met. As a result, only 3 people would have been hired. And I think that the workload of each person will be heavier. I don't think one person can take up the workload of 2 people. There may be a higher number of vacancies among the care worker sector. I think that we have to look at the staffing requirement at the same time. Thank you. Undersecretary. I thank Ms. Mann for the question. After amendment to the ordinance, we are implementing the new staffing requirement. We have to clarify something. We do have this statutory staffing requirement. For subsidized care home, we have a grant for them to adjust their manpower. In the RCHEs, we have care workers, we have health workers, HCPs, and enrolled nurse. EN and HCP can only carry out duties assigned to them, such as catheterization, inserting feeding tube, so on and so forth. If a RCHE hire one nurse, one HCPs, and 2 care workers, then perhaps the care workers would take out most of the general duties, and EN will be playing the manager role. Well, that's up to respective RCHEs. I believe that RCHEs will choose the plan best suited for them. Mr. Chong, thank you. We will keep the staffing requirement unchanged, and we want to allow flexibility for RCHEs to hire either one enrolled nurse or one HCPs. We have not lowered the staffing requirement. We have created this new rank of HCPs. RCHEs can hire a HCP instead of EN or hire an EN instead of HCP. We have not lowered our staffing requirement. They can still keep their care workers. Thank you. Mr. Tam Chan Kok. Thank you. I support the creation of this new rank of HCP. The government have amended ordinance to increase the area per square foot per resident. I support enhancing care quality through training of the staff to make sure that residents receive professional care, and I support the creation of a career progression path for care workers to cater to the manpower problem. Some other members have asked about the salary. The undersecretary said that they will have to look at the market. When I consulted the sector, they are concerned about the salary level as well. Will there be a difference in terms of salary between enrolled nurse and HCP? They are worried that HCPs may be paid less, even though they may be taking up the same duties as that of enrolled nurse. The Undersecretary said that the RCH can either employ EN or HCPs, and the training content is more or less the same. However, the training hours of HCP is just some 30% of that of EN. Will then less people enroll for EN courses? Thank you. Undersecretary. Thank you. Let me reiterate, we have not reduced the number of training hours for HCPs. We are providing training in a more targeted manner. The HCPs trainees will have to be trained for some 700 hours. However, when they were a care worker, they would have already received training of 200 hours. We ask the HCP training to have worked as a care worker for 3 years. Or health workers, rather. So please rest assured, we will try to instill people's confidence in this new rank. We can compare the salary of HCP with that of, say, registered nurse. I believe that their salary will be more or less the same. As RCH can either employ EN or HCP, I believe that the market will make the relevant adjustment. Thank you. Next, Mr. Alex Ban. Chairman, RCH is faced with a manpower shortage, and this problem has troubled the sector for quite a number of years. I'm glad that the government is proposing this new idea of creating a new rank of HCP. I fully support that. I have 2 suggestions. First, a number of training quotas. It is said that there will be only 60 training quotas for HCP, but That's very few compared to 5,500 health workers on the market. I wonder if the government will increase the number of training places after the first cohort has been launched. Will you say offer nighttime courses so that more health workers can receive training? Second, I'd like to ask about the entry requirements. It is said that applicants for HCP programs will have to have at least level 2 or above in 5 subjects. However, some health workers who have been working in the sector for a number of years, they may not have such academic requirements. Will you allow for some exemptions, say for example for health workers that have been working for 10 years, will they be exempted? Thank you.
Under Secretary. It will depend on the operation of the first 2 cohorts of the programs as we decide on whether we will expand the number of places for the program. As for the entry requirements, I understand that some health workers may be less educated, and with their years of experience, they try to move up the career ladder. However, for the HCP position, we do require the applicant to attain certain level of education qualification. So currently, we do not have a mechanism in place to recognize those with lower education level but with higher level of job experience. However, we do welcome those who do not meet the entry requirements to continue to serve the social welfare sector. Ms. Elaine Chick, I agree that the government should establish this new professional rank. I support this initiative because we need more manpower for the sector as we face an aging population. However, there are concerns from the public. For example, will the government import more foreign labor, and that will cause more uncertainties to practitioners in the industry even with the establishment of the new HCP rank. Will the government undertake that in the near future it will not import HCPs from other places to safeguard local employment? Also, I'd like to ask about the career prospects for future HCPs. Will they be like current health workers providing private home care services? Also, I'd like to ask about the subsidy scheme for the PD program for HCPs. One of the requirements is that those who graduate from the program will have to stay in the social welfare sector for 2 years. For HCPs who are engaged by private organizations upon graduation, will they meet the requirements of the subsidy scheme? There are concerns that HCPs who obtain the qualification upon graduation from the PD program will switch to the private sector, and that would defeat the purpose of establishing this new rank. Under Secretary, there are currently about 100 registered workers that are imported from other places, and that accounts for only a very small share of the total number of enrolled nurses in Hong Kong. Next year, as the amended legislation take effect, we will see a high staffing requirement, and there won't be enough enrolled nurses. So we will, through various channels, bring in nurses and health workers. We have locally trained nurses. We have already bought all the places for enrolled nurses to provide training opportunities for those who want to become nurses. And we also have health workers. We also have nurses under limited registrations. We hope that through various channels we will be able to replenish the manpower supply in the sector. For those who are brought in by other places, they may not be familiar with the local sector. So I believe that there are institutions who lean towards hiring local workers. So the HCPs will work in RCH for the first phase, but in the future, whether they will serve sectors other than the social welfare sector, we will look into this. Yes, I'll ask Mr. Chong to elaborate. Well, let me supplement. The purpose for us to train up HCPs because we want dedicated professionals in the for the social welfare sector. Upon graduation from the PD program, they'll have to work in the social welfare sector for 2 years. Otherwise, they'll have to return the subsidy granted. We need health workers in the RCH. Of course, these HCPs, upon graduation, they can provide relevant services in the community. But it is a statutory requirement to have this kind of HCPs working in the RCH in the future. So even though they work in the private sector, they will still meet the requirement under the subsidy scheme. We want to cultivate dedicated talents for the social welfare sector. So we want HCPs to provide home care services as well as other services. Currently, these services are provided by NGOs primarily. If future HCPs upon graduation they work in the private sector, we'll have to look at the nature of their work to decide whether they meet the requirement. Next, Mr. Webster. Dr. David Lam is concerned whether one nurse or one HCP, one nurse is equivalent to 2 HCPs. So a total of $120,000 will be offered by the government in the future under the PD program. Will the manpower crunch be addressed with the new HCP rank? You said that according to the law, one nurse or one HCP is considered equivalent to 2 health workers. That might lead to a reduction of frontline staff, and that would affect the service quality in RCHs, and that would also enhance the burden of social workers. Also, will there be overlapping of duties between enrolled nurses and future HCPs? I think it's crucial that you make clear the career pathways for both jobs. How can you ensure that there are new entrants to the sector, and at the same time, the two people will not compete for nurses as well as HCPs. Enrolled nurses are widely recognized by the social welfare sector. Enrolled nurses can serve a lot of different kinds of institutions. So they may choose to work in hospitals or medical or healthcare institutions. So we see that enrolled nurses may switch to medical sector, and that leads to a brain drain in the social welfare sector. That's why we are proposing to establish this new professional rank, and the remuneration package of the future HCPs will be similar to that of enrolled nurses. You said there might be competition between the two job types. But we welcome nurses to join the social welfare sector as well. We might have to work on this in order to achieve this target. I'll ask Mr. Chong to elaborate. To respond to Mr. Ng's questions about the manpower crunch, we all know that we are facing a manpower shortage in RCHs. It's hard to both recruit health workers and retain them. There's currently no career progression pathways for health workers. So we have 4 goals. First, we want to provide a progression pathway for health workers to attract newcomers to join the trade. Second, we want to enable RCHs to have the flexibility to hire workers. They can, in future, choose to recruit HCPs or enrolled nurses. That would be a great flexibility for RCH. Third, we want to cultivate a pool of dedicated talents for the social welfare sectors. We want to be able to train up a group of professionals that would stay in the social welfare sector. And fourth, with the dedicated talent pool for the social welfare sector, we won't have to compete for nurses or healthcare professionals with the medical sector in the future. And in the long run, we will be able to address the long-term manpower crunch in the social welfare sector. We hope that through the multi-pronged approach, we will be able to address the manpower shortage. And I believe this answers the question about a competition between nurses and HCPs. Mr. Chao Shiu-chung, I support the idea of establishing the new professional rank of HCP so that there is a clear progression pathway for health workers. I hope that the government can offer full subsidies for those who enroll in the PD programs. I have 2 questions. By establishing the new professional rank, the government wants to encourage health workers to move up the career ladder. I think this can help boost the confidence of existing health workers. Just 2 weeks ago, I got a case. There is an enrolled nurse who works 5 days a week and 58 hours per week. And the nurse earns $28,000 a month. With imported nurses, local nurses lose the competitiveness and may risk being dismissed. Not to mention our future HCPs. Will future HCPs have the competitiveness to compete with technical talents in the future? It only costs employers $22,000 to bring in technical workers. So we see that there is a gap in terms of the remuneration package between imported workers and local health workers. Also, according to the paper, health workers need to get a recommendation letter in order to be enrolled in the PD program. If the institution they belong to does not recommend them, they won't be able to be admitted to the PD program. This could be a potential problem. Employers might be reluctant to recommend health workers to enroll in the PD program because employers will have to make many changes in order to make sure that their health workers could study in the program. Under Secretary, under the admission scheme for technical workers, they have to earn the median wage in order to be brought into Hong Kong. We welcome employers to bring in technical workers if they are willing to work in RCH. Even nurses find it hard to secure a job in RCH, so we welcome imported technical workers to work in RCH. But our feedback, the feedback we got is that if there are enough health workers in Hong Kong, institutions or RCHs would like to hire local workers first.
副局長頭先講得啱。
The Undersecretary was correct. As we talked to the persons in charge of RCH, they are more than happy to hire local workers. And they are more inclined to hire locally trained HCP as well. They told us that local workers have their competitive edge. They are well versed in local culture. They know about the RCH environment in Hong Kong. They know what the elderly and PWD in Hong Kong need. Some RCH operators told us that they are offering a higher pay for their workers. They are paying their health workers the salary of a registered nurse. So I think that we have to be confident in ourselves, and we hope that we will be able to recruit the first cohort of HCP as soon as possible. Regarding the programs that we offer, it only accepts health workers that are on the job. Among the 780 learning hours, some 280 hours are on practicum. In other words, the health workers will have to leave their jobs temporarily to undergo training, to undertake practicum, and during that period of time, RCH will have to continue to pay them. That's why we need the consent from the RCH in order for health workers to be able to be enrolled in the PD program. As we talked to the RCH, they told us that they are happy to recommend potential health workers to undertake these PD programs. Thank you. Mr. Chong Hofeng, thank you. I support the creation of the new position. In 2022, Mr. Michael Tian from the Roundtable have been advocating for this position of HCP pitched at QF level 4. This is to tackle the problem of the lack of new blood in the social welfare sector. I thank you for taking on board our suggestion by creating this new rank of HCP. We have asked the social welfare sector about their views on this creation of this new rank of HCP. However, they have some questions. It is said that in Q3 of 2026, the government is going to enroll the first cohort of students, and each year they will offer some 30 places per cohort for each of the 2 institutions. So altogether, there will be 60 trainees in the first cohort. The Undersecretary said that they wanted to start small. So I wonder how many training places you will be able to offer in the future, and how many institutions are able to provide such programs. The first batch of graduates will start working in Q3 2027. In 2023, the government proposed and have a RCH miscellaneous amendments ordinance 2023 passed. The sector told me that they have difficulty in hiring enrolled nurse. When the ordinance come into operation in June, we don't have the HCP yet, so the sector wonder what they should do. Thank you. Undersecretary. We will try to offer more programs in the future, but as I said, we want to start small and speed things up later on when things get smoother. There are not that many institutions that are able to offer QF Level 5 courses, so we're working on it. As for the staffing requirements, the miscellaneous ordinance, well, part of it will come into operation within this year. We do have a requirement for 1 nurse per RCH, and regarding the 1 HCP per RCH, that requirement will only come into effect in 2028. We're trying to subsidize its programs for HCP while importing limited registration nurses. Thank you. Reverend Peter Kun. Thank you. I fully support the proposed amendments. In the last term of the LegCo, for some procedures such as catheterization or certain type of injections, maybe we should allow families that have undergone training to do such procedures. There are accidents that have happened before regarding nasogastric tubes. This is a rather complicated kind of tube. But for urinary catheters, if you do it wrongly, then the patients may be hurt, but their lives will not be in danger. But for replacement of NG tube, things may be more difficult and complicated. The Social Welfare Department will be the one recognizing the qualifications. Am I right? I think that you have to explain further. A patient may have their nasogastric tube loosened as they move. What should the procedures be? Thank you. All HCP and enrolled nurse will be qualified to insert or replace nasogastric tube for residents of RCH. As to whether fresh graduates of HCP and EN will be qualified enough to replace nasogastric tube, in RCH we have HA doctors monitoring the situation of the residents, so they can definitely help out. We offer continuous training for HCPs so that they can receive practice on such procedures, and I think that will boost people's confidence. I will see if the SWD has anything to add. Thank you. We attach a lot of importance to training, as mentioned by the Undersecretary. After graduation, HCP will have to perhaps undergo further training to enhance their skills. In the code of practice, we set out a requirement that the home manager of RCH will have to conduct assessment on the performance of HCP. And the home managers can arrange for doctors and nurses to provide assistance. If there's no other questions, then we conclude this item. The government plan to submit the amendment proposal to the LegCo in Q2 2026. Do members support the legislative amendment? No comment. Any other business? There being no, it will be meeting adjourned. Thank you.